Systemic muscle testing is based on the induction of surround inhibition. Now, the primary job of the nervous system is to look for threats. And if something feels threatening or unsafe, it causes global inhibition in the nervous system or decreased output. Now, there's been some studies on this where they use true-false testing, where the practitioner would use a true statement and then test a muscle group in the body and see if it tested strong. If it was a false statement, it would test weak. And when we apply touch to the body, as the clinician, our bioelectrical charge is actually more in a parasympathetic state. A client who has pain or overactivity, they're in a more of a sympathetic charge or more of a highly sympathetic state. And when we create touch in an area, it can cause this inhibition in the system. So we're going to take advantage of that. Now, to get a baseline to do this form of feedback testing, we're going to use some statements. We're going to use some truths and we're going to use some lies. Now, with Kevin here, I know he plays baseball, and Kevin also knows he plays baseball. So to get a baseline, I'm going to use the shoulder muscle, okay? And you can use any muscle group. You can use the lat, you can use fingers, you can use bicep, but the shoulder is typically the easiest so long as they don't have pain in it, because it's a long lever, it's harder for them, we don't need to use a lot of pressure. So I'm going to get a baseline from Kevin, so I'm going to create the box. So I'm going to stabilize on the opposite shoulder. I'm just going to bring his shoulder in a little bit so I can use a little bit more of that supraspinatus muscle. So I'm just going to ask Kevin to match my resistance. Good, and that's nice and strong. Now Kevin, I want you to say, I'm a baseball player.
I'm a baseball player.
Push. So his nervous system says, yeah, I agree with that. That feels safe. Now Kevin, I want you to say, I'm a ballerina.
I'm a ballerina.
Push. His nervous system didn't really like that. Say it again.
I'm a ballerina.
Okay? So by Kevin saying a lie, his nervous system said, yeah, this feels threatening. This is not true. And it shuts him down. Now say, I'm a baseball player again.
I'm a baseball player.
Push. And it turns back on. Say ballerina.
I'm a ballerina.
And it shuts off. So I am using far less pressure when he says ballerina, but it's whether there is a truth that says, yep, I like that, nervous system feels safe, I'm going to turn everything back on. Or if it's a lie, all of a sudden, nope, I disagree. Touching a painful area or an overcharged tissue will have the same response, which we're going to get into with some of our testing. Now just know, this is not a diagnostic technique. This is just a technique in which to guide where we may need to look at a little bit more closely with other tests to confirm what we're seeing.